Good morning, everyone. Today I want to talk to you about patients who want, let's say they have a lot of complex problems and they want all the dentistry done in one appointment or one visit, or they have the expectation everything has to be done really fast and quick, and how to deal with them. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Hervey Bay, in Queensland. I took it from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 14 years. And you can check my details below for credibility. So I'll give you an example. So a patient came to our practice maybe a few weeks ago, and the patient basically had periodontal problems, so bleeding gums, subgingival calculus, some probably around 8 crowns done somewhere overseas in I think from memory it was Vietnam or Malay or could be Thailand. I'm not sure. I can't remember which country exactly, but it doesn't matter. So those crowns had a bit of very thick margins, and there was a lot of subgingival calculus underneath them with red swollen gums. They also had a bit of a bite problem, so they had what we call like an open bite. The back teeth are worn down a little bit and touching heavily. The front teeth are not touching. And they had some lower crowded teeth as well. So the ideal treatment we know is going to take time. It's not going to be a one visit appointment. So for example, you need to remove those crowns, you need to temporize them, you need to put the tempers with better margins, you need to treat the gum problems, you need to wait until the gum is nice and pink and healthy. Then maybe talk about orthodontics to improve the crowding and close the bite a little bit more. Then, once everything's stable, deliver the crowns. So we talk about 6 to 12 months of treatment. But this patient was adamant that they want to walk into the practice, they probably want to be under sedation, and they want to have all the treatment done, all the crowns inserted, all the perio fixed in one appointment. And I have a similar situation as well. Another patient, for example, they had 20 years of damage. They have some cavities, they have some missing teeth, they have some perio as well, they have some worn down teeth, and they ask, hey, can all this be done in 1 month or 1 week? I got a very tight schedule and I need everything done really quick. Another example, all on 4 dental implants, they want teeth on a day because they saw the market about teeth on a day, so they want to walk in, teeth out, implants in, final teeth delivered within a day, and that's it, they don't want to see you again. I want to be very, very cautious treating those patients because the expectations there are very high. And I have seen videos of dentists in the US where they have the skill to get a patient under general anesthetic, full mouth rehab, opening video, putting aesthetic crowns. They can do it really well, but for me it sounds extremely stressful. I can't see myself doing it, and I don't want to even learn about it. And I don't want this type of patient unless in 20 years that's going to be the norm and I have to learn that skills and I have to do it. But I can't think of anything more certain than that. So let's track back. So those patients, I want to be very cautious because the expectations are very high. And you need to have very strong, well-documented communication with them. And you need to establish early on, are you the right dentist for them or not? You don't want to take these cases on and try to take them on and have these expectations, or they agree with you and they still have the expectation in mind. So what I'll do with these patients is I explain to them, look, the problem you had or you have at the moment has been happening over the course of probably 20 years or 15 years. Even those crowns with the failed margins has been happening over 5 years. I'm not asking you for another 20 years to fix the problem. But if it has been happening over 20 years, it's not going to be fixed overnight. It's going to be fixed over a month. I probably need to give you something that will last you for many years. I need, depending on the case, let's say I need 6 months. I need 6 months to get your treatment right. Now I want to ask you the question. You mentioned you want to have everything done in 1 day. I need to understand why. Why do you have this expectation? Explain it to me a little bit more. You want to listen to them. Is it because they have a wedding in 1 month and they're really panicking about this wedding? They have to travel overseas and they're never coming back to your area again. They don't like sitting on the chair, they don't like the idea of having pain, so they think it's going to be pain-free just to do it once and leave and don't come back again. You need to understand what's in their mind, because if you don't know what's in their mind, you're answering the wrong question or you're trying to debate the wrong theory. If, for example, they have a wedding in 1 month, you have to be very honest with them. If your concern is to have teeth, nice looking teeth in the wedding, the best I could do for you, I will try to give you beautiful temporaries, as beautiful as I can for your wedding, and hopefully your gum will be healthier than now. But you're not gonna have the final teeth before the wedding. I'll be very honest with you. If that's really extremely important, I'll give you something that will look nice, good enough for the wedding, but not perfect yet. If it's really important to you, you might have to postpone the wedding or accept the temporary option that I'm giving you. But I'm not gonna give you final teeth. Be very clear about it. Is this a pain? I wanna do it all in one visit because I don't wanna have any pain after that, and I don't wanna coming back for appointments. What if you see a dentist who rush everything in one day because you want to do it in that way because they think it's going to be painless, and then because everything is rushed, you come back in 2 or 3 months with an infection, with a problem. We have to sit you on the chair and do it in an uncontrolled environment, in an emergency environment. Then we have to do more and more and more and so on. Wouldn't it be worse for you? Would you rather just do things properly once, even if it's going to take a bit longer? So you need to debate the idea. But be very clear with them for what time frame you need. Debate what they have in mind, and if you do everything properly, you have the right body language, you have the right eye contact, you have the right communication skills, you document everything well with them, you debate the thoughts that they have in their mind, you let them talk, and you listen to them about why they want things really quick. If you do all of this and you set the expectation how much time you need, and they still don't want to do it with you, no problem. Let them go. The worst thing you can do is try to convince them and push them to do it, and you try to accidentally promise something that you're not gonna be able to do and work under pressure. There is nothing worse than performing dentistry under pressure. Dentistry is a tough profession as is. If you try to do it under a time constriction, under pressure from a patient, it's the worst feeling ever. There's other patients waiting for you. Focus your energy on the other patients that will value your advice and value your time frame to fix their problems. Also, look at your marketing. I never market all on 4 teeth on a day because I like to do it in a certain way. I will place my implants, I will give them a temporary, usually on the 2nd or 3rd day. I will have the temporary made in the lab. I will upgrade the temporary in 6 months to ceramic or zirconia or titanium zirconia options. I don't rush things. I tell them that's how I do it. If you want a teeth on a day, those are the drawbacks you're gonna face. I don't offer it. I don't use it in my marketing. And patients get it. It's like, okay, I'll do it properly. I understand the time frame. I will do it properly. And then slowly, you won't have any patients coming to. I don't have any patients coming to my practice asking for a teeth on a day because I don't market for it, and I already filter this patient out. And the patients coming to see me, they're coming for quality. They're coming for something that they know they will last them for a long time. They won't have a problem with a temporary break in a few days or a few weeks because you rush to do it all in one day. Again, the future might change. In 5 or 10 years, this might become the norm and I have to change my way of running dentistry. But as we speak now, that's my view on the topic, and just be very cautious with this type of patients, especially if they're not gonna get the value of doing things properly and that things will take time. If you find the information helpful, make sure you like and share with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, turn notification on, and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.